All right, so you have some neck pain or headaches, and you're interested in chiropractic care, but you don't want your neck cracked. Maybe you're just scared of it, or maybe you have a pre-existing condition that prevents you from getting your neck cracked or adjusted, right? So you want to know, is it possible to see a chiropractor if I don't want my neck cracked? And the answer to that question is yes. So today I'm going to take you through a non-force or low-force technique, treatment style that we use on our patients who prefer not to have their neck adjusted, or like I said, maybe there's some level of contraindication to getting their neck adjusted with a high force technique. So we're going to treat him with a low force technique. We're going to combine a few techniques that I like to use in these situations. The first being active release techniques, which is a myofascial technique, very effective at treating these types of things. And then what we'll do is we'll use a soft low force mobilization of the neck. So you can see what I'm doing here is I'm just getting in, I'm just playing with the joints of his neck, and I'm trying to establish where I feel that the joints are not moving properly. So remember, joints are designed to move. When they stop moving, they become a problem, and those problem joints are the ones that we want to address with care, whether it be a high force adjustment that you're used to seeing on TikTok, or a low force adjustment, which is what we're going to go over today, okay? So I'm going to start just by stretching these muscles on his neck. I feel some tension on the right side. Good. So Ermias, you should feel a stretch right underneath my thumb. My thumb's right underneath his neck on that right side. Do you feel that, Ermias? Yeah. Yep. Good. So you can see it's very slow. It's very anticlimactic, but also very effective. Good. So we'll do a couple passes on those muscles. Good. I also feel some tension on this upper part of Ermias' neck here, kind of right where those headaches come from, right in this area. A lot of people get a pain right at the base of the skull. So we'll do some ART on that. Good. Good stretch there. Good. So I always tell my patients to let me know if they're uncomfortable, if you feel any pain, or if you don't like the position I have you in, you let me know. Our goal here is just to kind of work these muscles. Because remember, the job of a joint is to move. The job of a muscle is to move the joint, right? So if the muscles are trying to move joints that aren't moving properly, they're going to be tired, cranky, and angry. So we want to calm those down, which will allow the adjustment side of this to go a lot smoother. So now that we're kind of done with the muscle side of things, and again, I just treated what I felt on Ermias. A lot of times that's a little bit more involved. I will work more towards the joint here. First thing I'll use is what's called a counter pressure technique. So I'll brace the segment below, and I'll just apply a little bit of segment pressure to the top, and you'll see how non-invasive this is. So with my left hand, I'm just holding, and my right hand, I'm just applying a nice little pressure to the segment above, trying to ease it to move. There's no big cranking of the neck. There's nothing like that. This is the technique I'll use if patients have a contraindication to chiropractic adjustment. If I don't feel comfortable putting them into deep rotation or anything like that, or maybe they've had an injury in the past, a whiplash injury, this is the technique I'll use. And you can see again how anticlimactic and how comfortable Ermias is, right? He just feels like tension underneath my fingertips. The second technique I'll use, if patient can tolerate a little bit more, it's just a motion move. So I'm just kind of, I don't know if it's not a very clinically sound description there, but so I'm just taking the joint to lockout here, and I'm just gliding the joint through its normal range of motion. Just trying to get it to move, you know. In these types of techniques, you might hear a little pop or click just associated with this gentle motion. But that's definitely not the goal of this technique, right? Good. How's that feel, Ermias?
Pretty good.
Yeah. So we're just trying to work those joints through their natural course of motion here. Good. 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 All right. Yeah. So that is essentially what we're talking about when it comes to low force treatments of the cervical spine, the neck. For whiplash, for tech neck, for whatever it is that you're dealing with neck pain for, but you don't want your neck adjusted. Anything to add there, Ermias? No, pretty good.